मुकेश कोई केस करा रहा है? अच्छा, चालू कर रहा होगा। लाइट तो चालू तो हो गया था इसका। जा रहा है। हाँ, इस पे तो दिखा सकते हैं, कोई दिक्कत नहीं। हाँ, यूट्यूब है ना ये तो, दिखा सकते हैं। अभी फेसबुक पे थोड़ी लाइव चालू किया है। हाँ, देख चेक करिए, फेसबुक पे नहीं करना। थोड़ी देर कैमरा पकड़ लेना, आधे घंटे 15 मिनट का काम है बस। So hello friends, today we are going to demonstrate you Manchester operation for the this third degree prolapse. This third degree prolapse, you can see there is some cystic nebothine follicles and a small fibroid is also there. So we have planned to amputate this cervix which is unhealthy and coming out. So we will first do the Manchester operation for this, and then we will fix this uterus inside with the new JDH technique where we are not using any mesh, and it is the suture sacropexy. So you can see this is the all the material is coming inside. So now we have injected diluted vasopressin, and now we are just we will cut this cervix. This is the bladder fold. This is the bladder crease. So unhealthy part of the cervix will be chopped off. So you can directly cut without separation of the vaginal mucosa. You have to be little careful that this cautery should not be touched nearby the structures. This tissue little unhealthy actually. I need to hold it from lower lip. So this all unhealthy part came out. Now you just repair this part with the Vicryl. This is the rapid Vicryl because needle is good and fast dissolvable. कितना बड़ा है? Length. This is the 110 centimeter. थोड़ा छोटा कर लेते हैं. So this is the suture, 0 and half circle. इसको हाँ, 1/3 हटा दो, 2/3 हटा. हाँ हाँ. इसको पकड़ना. So we will cover this raw area with the sutures. So take one or two sutures continuously, then we will make it interrupted. Suture coverage is इसके ऊपर से पकड़ लो इसको. Suture coverage is important. ला मुझे दे दो. Clean भी कर दो. So this raw area is actually using, which will soon will be taken care of. Cut through again. So we have to take good bite so that the tissue will not cut through. राउंड बॉडी नीडल है ना, वो नहीं निकलती इसमें आराम से. So this is good idea. You should take the taper cut needle which we are using in the episiotomy suture. पकड़ ले इसको, बांध देते हैं उसको दोबारा. So I will give a knot here and then continue with the suture only. You can use the interrupted sutures also. रहने दे, काटो मत. इसको काट. कोई बात नहीं. तो ऊपर उठाना. There is no difference in the continuous and interrupted sutures. Whatever suture you will take, it will cover the raw area completely. This is the cervical canal where we are taking the sutures. छोड़ दो. So after, क्या कर लो, आराम से कर लो, फोन करो. अपने कोई जल्दी नहीं है. मुकेश को ये थोड़ी जल्दी है ना मुकेश. बस और 5 मैक्सिमम 5 मिनट. So almost done. 3/4 part done. So again I will tie a knot here. हो गया. उस पे यूट्यूब पे कर रहे हैं. यूट्यूब पे कर रहे हैं. किसको कर. So almost 50-60 centimeter thread is sufficient to cover the full cervix. So we almost reached the upper part. So it is done now. So all the row area now covered. Just around it. So it is circularly covered and done. So this Manchester is the easiest operation which anybody can perform, but it may affect the fertility. So in the fertility desiring patient, but this kind of the cervix needs amputation because you can't heal with the medicine. So you can see it's a good. Sir, नीचे दिखा दो. So this is very well visible. So I will just now fix it. Uterosacral shortening is done. So it will go little more higher up. ठीक है. चल. Thank you. ढंग से उसको पकड़ा ना. ऐसे कहाँ छोड़ के जा रहा है? So now we will start the laparoscopic part, and laparoscopic part we can demonstrate over that. Gloves दे दो. यार एसी नहीं चला रखा आज तो. सुनो एक बार यार इसको टाइट करना ना. बेल्ट शायद लूज है. मैंने चला दिया ऐसे. ये चल गया क्या? So what we are going to demonstrate. अब है ना फेसबुक वाला लाइव चालू करते हैं. हाँ, बस हम एक बार वो ट्रोकार डाल दें 1 ही मिनट में. नहीं इसको भी चल दें. हाँ. So we are now putting the trocar. This is 2 finger above the umbilicus. गया क्या? देखना एक बार. लगता नहीं गया. नहीं है? नहीं गया नहीं गया. मेरे को लग रहा है थोड़ा ब्लंट हो गई है. अब डिप जाने में तकलीफ थी. पहले वाले पेशेंट में बड़ा. हाँ. गैस ऑन कर दो. हम्म. हम्म. मेरे चश्मा दे देना, ये पड़ा। 2 नंबर एथीबॉन्ड ले लिया। हेड डाउन. So after placement of the trocar, we will put the two on the left side and one on the right side. So friends, today we are going to demonstrate you GDH technique of the prolapse repair. Here we are not using the mesh, and it is a type of the natural tissue repair only. We are using 2 number ethibond to fix the uterus with the sacral promontory. That is an innovative technique that mesh has own side effect, and here we are not going to use any mesh, and we will fix bilaterally uterus with the sacral promontory following the uterosacral ligament, and it will strengthen the uterosacral ligament and strengthen the uterosacral ligament with the ethibond suture only. Ethibond suture is a permanent suture. Stay inside. So it is a good technique uh, for the old ladies where we don't want to put mesh because of the high chances of the mesh erosion, or the young ladies where both are working. Okay. uh, where the patient is not willing to put mesh or use the mesh, or the mild degree of the prolapse, like in this lady, where Manchester cervical elongation and erosion was the problem, along with little अब हमें ना नीचे वो भी चाहिएगा, यूट्रस एलिवेट करना पड़ेगा, किसी को बुलाना पड़ेगा, यूट्रस एलिवेट करना पड़ेगा. So till the uterus, we need to push the uterus inside and uh, antivert it, so we can expose the posterior compartment, so we can dissect into the posterior compartment till we prepare the sacral promontory. Sacral promontory will be prepared bilaterally, and we will take the suture on the anterior longitudinal ligament. दिखाओ. So we will prepare first on the right side, then we will expose the left side. So this is the small intestine. This is small intestine, a little adhere. So I will little bit mobilize it. गिर गया उसमें. दूसरा ले लो या so this small intestine also adhered here. So we are just mobilizing it so it will go out from the field. Because if you do not mobilize it, then it will come again and again in the field. So spare 2 minutes to mobilize it. Here you can see the ureter is here. This is the IP ligament, and this is the tube and ovaries which is looking healthy. This ureter is going till here. This is the uterosacral ligament, uh, well seen. So this is the sacral promontory. See, you can see the uterosacral ligament is visible. It is coming till here. So we will expose the promontory here only. Suction कर लेते हैं चलो एक बार. So uterosacrals are good in this patient. So it is a good candidate for this kind of the surgery. So where we are strengthening and shortening the uterosacral ligament only. See, this is the uterosacral ligament. So uterosacral ligament seen well. This is the ureter. So when we do the plication of this uterosacral ligament, we will give a nick here. So this separate the ureter from the uterosacral ligament and prevent the kinking. So if the rectum is coming again and again, then you can suture it on the right side, left side. But I think I will handle without suturing it. So we need to expose the promontory here. Once you give a cut in the peritoneum, gas will do the rest of the job. यहाँ से पकड़ लो. बस ज़्यादा नहीं उठा. So here we don't want to go deeper and don't want to disturb the inferior hypogastric nerve, which is at the base of the uterosacral ligament. उठाओ मुझे था उसे. I'm just exposing the ligament. See, this is the median sacral vessel. So exposing the promontory or anterior longitudinal ligament is ideal, because if you take the suture only in this fat or superficial layer, then quite good chances of the failure. So this ligament is exposed well. So we will take the suture and plicate it here till. So I will give a nick between the ureter and the uterosacral ligament also. थोड़ा सा यहाँ से ऐसे पकड़ लो. रुको पहले तुमको पकड़ाते हैं. पकड़ो. So this is the uterosacral and that is the ureter side. So I just giving a nick. So I just separate the ureter. So these are the standard steps for this operation. First prepare the promontory. Give a nick between the uterosacral ligament and the suture. So we will do from both the sides. So now here we have to prepare, mobilize the sigmoid colon to expose the promontory on this side. So this is the bilateral fixation. So it is always better than the unilateral fixation. Because again unilateral fixation, little higher chances of the failure. just mobilizing this so it will go out from the field. So side करो. So ureter will be here only. So first we will locate where is the ureter. Oh, देखना क्या bleed हुआ. छोड़ना है. So because of the pulling the tissue, this fat tissues start oozing. So it will stop spontaneously. थोड़ा सा bleed मार रहा है. So here will be the ureter. है क्या आ गया पेशेंट. हाँ हाँ कर दो ना. वो तो यहाँ तो और भी कोई पकड़ लेगा. सीने की जरूरत नहीं. So this is the uterosacral ligament here. So एक second. So ureter is here. This is the ureter. नहीं है वैसा है. ureter. ureter भी तो यही होगी ना. ureter ज़्यादा लग रही है. See? देखो आर्टरी इस साइड है. नहीं हैवी ureter ही लग भी ureter ही नहीं है. हाँ. So ureter is this side and so now we can just separate on this side. So this is the promontory here. यहाँ से करना है. ये पूरा जाएगा. So some vessel is here, so we need not to poke into the vessel. So mesenteric vessel of the sigmoid. So on dissecting on the this side is little difficult, but with the practice you can dissect on this side also. तो उसको खींचो मत ऐसे ना फट जाता है. छोड़ो एक बार. इसको खोलो. हाँ बंद करके रखो और ऐसे रखो. हाँ टिश्यू खींच जाता है ना. So this is the promontory. It is feeling hard here and no tissues, other tissues here. Just I'm layer by layer I'm opening here. So you can just feel the hardness and then you can separate the upper superficial fat tissue and other facial layers. So you can expose directly to the anterior longitudinal ligament. Because of the infection in this patient, you have little oozing surfaces. So this is the promontory on this side. All the vital structures already separated, and we will take a bite here also. So this is the small layers. Chalo. So one more nick on this side also. उधर करना है यूट्रस का. हाँ. हाँ, इसको इसे करना. नहीं, अब नीचे दिखाना. So this is the uterosacral ligament and there is the ureter. Ureter दिखाना. So ureter is quite higher in this side. This is the ureter. So you just hold this. Pull करो इधर. हाँ. So I will give a nick in between. So this way it will not kink the ureter in any manner. Sure. ठीक है. So now we'll start suturing and complete the procedure. किसी को अगर तुम्हारा रेडी हो जाता है तो तुम बिठा देना किसी को. कितना दे रहे हो? हाँ, दो खोल लेना, तो अलग अलग लगा देंगे दोनों साइड. So we are using ethibond 2 number, so quite thick thread and good to support the uterus. Ethibond 2 number. लो, इधर ही ले लेंगे पहले. थोड़ा यूज कर रहा हूँ. यहाँ से लो. So little oozing is here. Suction. So just I clean the surface. दिखाना. As such, no active bleeding, but this is small oozers are bleeding. हाँ. So we have taken a good bite through the promontory, and now just tie it knot here. थोड़ा सा पूरा करना. हाँ. हाँ. So this will make an anchor uh, and bridge between the uterus and the sacral promontory. थोड़ा सा ऊंचा पड़ रहा है पेशेंट ना. पाटा दे देना, उसको बोल दो किसी को. हाँ. अच्छा. सर का दे. हम्म. हमें तसल्ली कहाँ था। लगा दो उसके पीछे लगा दो। अभी तो चाहिए नहीं, अभी चाहिएगा तो ले लेंगे। अभी सूचरिंग कर रहे हैं। थोड़ा सा ना हाथ ऐसे हो रहे थे abducted। अभी ठीक है। ये क्या अपन लगाते हैं ना, इस पोजीशन से ज़्यादा ऊंचा हो जाता है पेशेंट। हाँ। और फिर लेफ्ट साइड जल्दी से सूचर भी नहीं करते। ये भी थी एक समस्या। So we are not routinely actually suturing on the left side generally. So it is little क्या हो रहा है? हाँ. So now we will take move our suture into the peritoneum. ये नीडल होल्डर सही नहीं है। ये नया वाला है। ये तो सही नहीं चल रहा। छूटे रहा है ना बार बार। So this is the uterosacral ligament. थोड़ा सा इधर से निकालना पड़ेगा इसको। हाँ, थोड़ा मीडियल निकालना पड़ेगा। तो यूट्रोसेक्रल का डायरेक्शन इधर है ना। So we need to first see the direction of the uterosacral ligament. See, this is the uterosacral direction. So taking a good bite through the uterosacral and plicating. ओफो, यहाँ से पकड़ लो, इसके बेस से पकड़ लो। हाँ, इसको नहीं पकड़ो, वहाँ से पकड़ो, उसका पेडिकल पकड़ो। हाँ, ये ट्यूब नहीं पकड़ो उधर से। So you can see this now it is taking into the uterosacral। ऊपर दिखाने का जहाँ से अपने सेक्रल व मुंड्रे। देखो। So this is the suture which we have taken here. Which one? So I just want to check. See, it is a completely holding. So you can take the thick tissue bite. है, कर तो ये भी सकते हैं, लेकिन फिर क्या होता है, थोड़ा सा प्रॉब्लम हो सकती है ना। एक जरा सा भी लूज हो तो एक ही धागे पे अटक जाएगी सारी कहानी। तो अपन इसकी को आप, हाँ, पकड़ो वहाँ पे। we will not over tight the sutures and just plicating. So I will take few sutures from the back of the uterus to pull the uterus posteriorly and make it anti-flexed. Now I will start retro suturing and come till the promontory again. It is now kind of the baseball sutures, so we need to know the suturing from both the hands. Hmm. So we are not over tightening, we are just pushing, taking that much actually coming easily. Sure. So it is, you can see now it is not going back, it is staying here only. आगे से यहाँ से. So again we have taken a suture from the promontory. इसका दूसरा थ्रेड है क्या? इससे बांध. So now we will tie it. So same procedure we will repeat on the other side also. So this will fix the uterus very well. And as you all know, the sacropex is the gold standard, time tested. Small oozing, do not worry about that. It will settle spontaneously till the end of the surgery. Because on this side we need to mobilize the sigmoid colon also. So on this side it is finished. हटा के रखो इंटेस्टाइन. छोड़ दो. So it will covered by the intestine directly, and this is the permanent suture, so nothing will happen, because generally we are using the silk in the intestine repair, so there is no confusion that this thread will do any harm, because it is a kind of the silk only. हाँ, ये तो कम पड़ेगा ना, so it will एक साइड ही जा पाएगा ना. We will take the new thread. So अब आधा कर लेना, आधे से भी थोड़ा कम रख सकते हैं क्या? 40 मिनट हुए हैं। उस पे 45 हो गए, 15 मिनट लगे अपने को मैनचेस्टर में। So we have done the Manchester for this patient previously first, and then we started the laparoscopic repair. On our channel, YouTube channel, we have telecasted the Manchester also. So after mobilization of the intestine, it is now problematic on the right side also. So you can see good bite I have taken with this big needle. So this needle is very stout needle. It will not bend, it will not break. Nothing will happen to this needle. थोड़ा सा बड़ा रख लेते हैं, बाद में बांधने का काम आ जाएगा। So it is always we are taking the 3 throw, then 2 throw, and then 1 throw. So now we start again. So now you can see which when we plicate only one side uterus is deviated on the one side. See, this uterus is going on this side, but once we put the suture on this side also, यार ये तो बिल्कुल ही नहीं होल्ड कर रहा। आ गया क्या? लग नहीं रहा कि नया है, ऐसे क्या रिपेयर किया हुआ है। आते हैं। See, this is the uterosacral. So this side uterosacral is little in little better condition. And suturing is also a little easier because this side we actually doing lot of the things, and sacropexy routinely are doing on this side only. And one side you can use for the wall suspension in after prolapse surgery, hysterectomy operations. So this will prevent the future wall prolapse. So you can see this side suturing we have done little faster. बस हो गया, 5 मिनट मैक्सिमम और। टाइट करेंगे इसको, देखो. So I will take a suture. So taking the bite from the this side also. Yes. So now you can see both the uterosacrals are joined. Now I will take the back sutures and come back to the sacral promontory. So it will take the double thread passing and strengthening the uterosacral ligament and making a good anchor. छोड़ो. आ गई ना रिवर्स ये तो आ गई रिवर्स अभी. छोड़ो. हाँ देना ही पड़ेगा, वो थोड़ा तो देना पड़ेगा क्योंकि भी रिवर्स इसको निकालेंगे भी तो सही. 5 मिनट का भी नहीं था. हो गए. उससे पहले ही आ गई ना तो आपको किससे पता चलता है. So both the uterosacrals now well suspended, well strengthened, and we reached again towards the promontory. Now we will take the suture. वो निकालो धागा. चल रुको मैं निकालती हूँ. So now we will tie it, and you can see the whole strengthened यूट्रोसिक्रल। अच्छा, केस अपन ने जल्दी निपटा लिया, है ना। क्रेडिट से अपना टाइम तो कम हो गया, आधा ही हो गया टाइम। अपन 4 केस इतनी जल्दी तो नहीं निपटा पाते, 6 बजे हैं अभी तो, मतलब 2:30 बजे अपन ने ओटी, 3 बजे ओटी चालू किया है ना। 3:25 पे बताओ, तो वो तो कितना, वो तो 35 मिनट में ही हो गया था ना केस। हाँ, थोड़ा सा टाइम खराब कर लिया अपन ने। नहीं, थोड़ा लाइव में भी तो अभी टाइम खराब किया ना अपन ने। हाँ। So finally this procedure is done, and you can see we have not used any mesh and anything, and just a simple suture repair is sufficient. And the small oozing, so no need to worry about this. It will stop spontaneously. Ureter यहाँ से एक बार देख लेते हैं. So this is the ureter. So on this side also, all the bleeding is settled. Nothing, no need to worry. चलो. So peritonization happen in the first 24 hours only. So there is no need of doing any covering of this open peritoneum. So this will settle automatically. चलो अब तुम छोड़ दो, छोड़ दो, निकालो. So you can say uterus is now at normal position. See, so this is the complete repair on both the sides. So the bilateral repair gives the benefit on the both the side suspension and give more fixation. इसको थोड़ा रिलीज करेंगे, निकालने का. इसको तो यूरिटर थोड़ा सा तो दूर ही है. ये है यूरिटर, तो ये वाली है. दिस इज द यूरिटर. तो ऐसे भी स्टैंड, ये बिल्कुल फ्री पड़ी है. अच्छा, तो एक ओके. थैंक यू फ्रेंड्स. एक बार नीचे का फेसबुक का बंद कर दो एक बार लाइव. सो थैंक यू फ्रेंड्स. हाँ, ये वाला बंद कर. हाँ, एंड कर दो. हाँ, एंड हो गया ना. हाँ, ठीक है, कर दो एक बार. हाँ, हाँ, इसको बस. इस so we will see the final picture. We can't show anything over the Facebook. So दिख, अब नीचे लाना कैमरा. So uterus is very much normal position at ischial spine level. Gone very high up. वैसे पेक्टोपेक्सिस से ज़्यादा ऊपर जाता है. देखो कितना ऊपर गया. So it is a very much at the normal position. See, too high. सीमा देखो कितना ऊपर गया, अच्छे से गया है ना. वो थी ना अपने पास. ये नया लेते हो क्या? So we are just showing you with the scale. That is 1 centimeter here. So it is the cervix and it is the hymen. ये दिखाओ ये वाला point. This is a 7 centimeter. So it is a 7 centimeter inside, and there is no cysto, no recto. Nothing is in there. चलो बढ़िया. बंद कर दो. अभी YouTube लाइव भी एंड कर दो. बस एक बार अंदर है ना, तुम अंदर डालो, मैं फोटो लूंगी. मैं करती हूँ, तुम दिखा दो बस.